Testing for COVID-19 is a selective process simply because there aren't enough to go around. Tonight, one woman shares her account as an untested presumptive positive patient.
41 Action reporter Ariel Rothfield shares the story and why doctors say they have to make these tough decisions.
I've never felt my heart like that before, so I was concerned.
1 week ago, Kelsey Miller sat in the emergency room, fearing she might test positive for the novel coronavirus.
I kept getting worse.
Today, she sits inside her home, presumptive positive, even though she was never able to get tested.
It is here, and not everybody's getting tested for it. And there are numerous cases like me that are getting sent home and just saying, go and treat yourself at home.
With information and guidelines rapidly evolving, we spoke with Dr. Mark Larson of the St. Luke's Health System to learn more about the decision-making process on who gets tested.
The criteria on what we're using to test is typically based on what your risk factors are for if you develop severe disease.
And it's changing as more tests become available. Today, the hospital is doing in-house testing, which means doctors are getting results faster. So they're testing more, including people who have symptoms and work in the healthcare setting, our first responders, immune compromised, as well as those who have known or confirmed exposure to patients with COVID-19.
Those people that I listed immunocompromised potentially have worse outcomes. So to identify that earlier, and so that when people do come into the hospital, if they happen to come back and get admitted, we're already prepared and we know who those people are, that we can isolate them and we can start treatment on them a little bit sooner rather than later.
Otherwise, Dr. Larson says the best thing to do is self-isolate, since most of the treatment is supportive, which is what Kelsey Miller is doing.
I think the numbers that we see on the from the state reports are very skewed. So if there were more tests available and we could really know what the numbers are, I think people would take it a lot more seriously.
Reporting in Jackson County, Ariel Rothfield, 41 Action News.